It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. Candace Kruger along with Jim Knox. We're back again with another edition of Best Docs Network, featuring some of the best physicians in the Dallas-Fort Worth area that help change people's lives.
That's right, Candace. This is the place to go to find one of the best doctors, like our first best doctor, plastic surgeon Ricardo Mead.
Courtney is a classic revision breast augmentation case that had had a series of failed operations.
Sometimes it could be painful, especially lying down. Not wearing a bra was not an option for me. I would even sleep in a bra 24 hours a day, always wore underwire.
The planning was intact. It's her tissues that were just structurally not sound. And if you need to reinforce tissues, then using this product will completely change her outcome.
With Dr. Mead, he was very confident, he was very kind. This has obviously been something that's been very self-conscious for me, so I felt very comfortable in talking about the issues with him. I felt confident that he knew what he was doing, that he had experience in doing this, and even after my consultation, his office staff was wonderful in trying to accommodate everything and make sure that this surgery could be possible for me.
It's almost like a push-up bra that you can't see in there. So at this point, I've figured out, I think, right where it needs to sit. I've been very happy with those results. In Courtney's case, it was a home run. I mean, the problems that she came to me with, although previously would have been problems where I might have just turned the patient away and said, I can't help you, I don't have the skills needed for this. With the problem list that she came, I knew I just check-marked each one down the line. I thought, we can fix this.
I'm still in recovery somewhat, so I have to be a little bit careful, but you know, I'm back to running. I can stand up and feel comfortable, and not only has my self-esteem drastically improved, but I feel like I'll actually be able to do things like a normal person.
With this product, I can reposition the breast implants, and that's an opportunity for her to change out her breast implants. Maybe she did saline, wants to switch to silicone.
The first time I actually saw the finished results and, you know, I took the bra off, I couldn't be happier. I mean, I was just ecstatic, and this procedure has drastically improved my lifestyle. I'm much more comfortable. My self-esteem has improved, and I couldn't feel better.
For a little over 10 years after I had a severe case of shingles, it was in my face and in my scalp, I was still having a lot of pain.
Shingles pain or post-herpetic neuralgia is a very painful condition. Humans are exposed to the chickenpox virus at an early stage in life. Sometimes the virus stays dormant in the nervous system and reactivates itself at a later stage. When that happens, people end up with shingles.
Sometimes, if it's severe enough, I have injections. It's been the best experience because he gives me the medication that takes the edge off, and hopefully, at some point in time, he says it's possible that the pain will go away.
Shingles pain or post-herpetic neuralgia is a very tough disease to treat, but it does not preclude us from helping patients to achieve pain freedom and control their pain as much as we can.
From just meeting him first time, it did not bother me at all. It never bothers me when I come in for an injection.
And I've been seeing her right now for almost a decade. Her pain has been maintained on the medication. on and off on average maybe once a year or so, her pain will flare up and we'll go back and repeat the nerve block on Sandra and she'll get better for a while. And so far she's been doing okay.
He's really somebody who is easy to listen to. He's easy to let him administer the pain medication, do the injections, whatever's necessary there.
It's very important to be compassionate, listen to the patient, see the problem they have, and try to control their pain as much as possible. Nerve pain generally is very difficult to treat, and this condition can linger for months or years before it gets better. The disease will get better over time, but takes a long, long time before it goes away.
I feel very confident that Dr. Farhat is working to help me have pain freedom.
Cindy had trouble losing weight until she met Dr. Kim. To find out more about Cindy's story and other life-changing stories, log on to bestdocsnetwork.com. Best Docs Network DFW is presented by Forest Park Medical Center. Extraordinary is all we do.
Roger is a patient that came in immediately before Christmas. He was a gentleman in his 60s who was attempting to go to the bathroom and passed out on the floor. And when he awoke, he was paralyzed from his neck down.
As it first happened, I was in and out of consciousness, but I was really frightened when first of all, I couldn't move my legs or my arms.
Unfortunately, when he passed out and fell onto the hard surface of the bathroom floor like a rag doll, he didn't have any support from any of his normal muscles because he was unconscious, and allowed all of that really significant arthritis to really hurt the spinal cord.
It was the very first time that I met Dr. Stachniak. I had never had an occasion to use a neurosurgeon. I was totally impressed with how she came across as being very confident. Also, I mentioned earlier her bedside manners, the way she just held my hand and gave me that feeling that it wasn't just going to be a business deal, but it was going to be personal.
We had to reconstruct his spine from the front and the back to take away really severe degenerative stenosis that he had developed over the years that was totally unbeknownst to him. It was a very complicated surgery that was about 5.5 hours. And after surgery, we had felt that everything went perfectly, but unfortunately he could only have some flicker movements in his extremities.
And I think one of the things that I wanted to happen was I just wanted to be well fast.
And it wasn't until a couple of months after surgery that he really started to see big improvements in terms of his strength and actually starting to gain the function to be able to walk. And then as months started to progress after that, many really significant kinds of improvements started to happen fairly quickly.
And then finally you get that courage, you get that feeling in you that that you can beat this thing, that it can happen.
We are hearing a lot about the West Nile virus infection now, and there is a lot of that out there now, but for most people it's not a big problem, so you don't need to panic. West Nile virus is like any other virus. It'll cause you to feel tired and feverish. Your fevers may even be as high as 102, 103, 104. You'll be achy and just generally feel bad all over. Now, again, in most people, it just goes away on its own. The people that it's mostly risky for are those who are over age 50 and those whose immune systems are not up to par. For example, people with diabetes, people on chemotherapy, older and frail people, or people with multiple diseases. So if you're in that category, you need to be real careful about seeing your physician if you feel ill. Normally, we tell people to take Tylenol and call me in the morning, or take Tylenol and give it 2 or 3 days. If you have an immune system that's not working very well and you have high fever during this West Nile season, well, you probably should be seen on day 1 of your fever, not day 3.
I went bowling as a team building thing for my school, and I picked up too heavy a bowling ball, and then it aggravated my elbow. After a few weeks, I decided I better come because it wasn't getting any better, so I better come see Dr. Nicholson, the fourth member of my family to come be a patient of Dr. Nicholson.
When patients come into the office, they want to be heard. And I think it's really important to sit down and spend the first 5–10 minutes with the patient, letting them explain to me what's hurting them, what is the history of their injury, and let them express why it is affecting their life.
Dr. Nicholson has performed 2 surgeries on me, and anything going forward will be by Dr. Nicholson as long as he's in this area. When I sit down and talk to him, it's like talking to one of your best friends. He treats you like he's not in a hurry. It's like you're the only patient in the world that walks into his office that day.
We have our own physical therapy unit, staffed by therapists who have their doctorate's degree in physical therapy. We stress hands-on. We really want our therapists to get their hands on the patients, work with them. It's important that they spend time with the patients just like I do in the office.
Physical therapy is right upstairs from the office, and we live 5–10 minutes away, so it's very, very convenient. I was at physical therapy 2 times, I think, and the therapist already knew me and knew exactly what part of my elbow was hurting.
A fulfilling thing to me is when we finish treating them, whether it be a child, whether it be a rotator cuff repair, whether it be a tibia fracture that occurred during a soccer game, is to have that patient come back in, now with a smile on their face, and walking out the door and participating in the sport or the activity that they used to participate in.
You wouldn't believe how many times people say, hey, can you send me Dr. Michelson's information? When people ask who my primary care physician is, I always say Dr. Michelson.
It is very reassuring, especially with 2 very active boys, to know that there are doctors like Dr. Michelson and his staff.
Jacob's quality of life was affected due to gastric reflux disease until he met Dr. Glenn Eide. To find out more about Jacob's story and other life-changing stories, log on to bestdocsnetwork.com.
Anatomically, when we have colon cancer, it spreads from the wall of the colon into the lymph nodes and then elsewhere. Well, up inside the abdomen, we can get way around these areas and include all the lymph nodes and everything else, whereas with rectal cancer, we're restricted by the bones of the pelvis. So it's more difficult to get widely around everything. We use radiation and chemotherapy in locally advanced rectal cancer, whereas we don't use radiation hardly at all up in the abdomen when we have colon cancer.
Being transferred to Argentina, just making a simple dinner for the kids one night. Getting ready for bed, I went upstairs just to go relax and stretch out. We'd only been there a month in Argentina. We were going to be there for 2 years. Went upstairs, got ready for bed, went to the bathroom, and it was full of blood. Woke up the next morning and the same thing happened, and absolutely no pain.
She developed some rectal bleeding and went in and subsequently underwent colonoscopy. She was found to have a polypoid growth right at the rectal sigmoid colon, and they took it out. Over the next 24 to 48 hours, she developed some lower abdominal discomfort and came back in to her physician to check it out.
And about 48 hours later, they gave us the news that it was full of cancer.
They recommended immediate surgery, but she didn't want to have surgery down there, so she called from there.
And I remember calling him from Argentina, and literally he says to me on the phone, okay, but I want you to get your butt on a plane, and I want you to come home and let me fix you.
We took out the section of small bowel along with the section of the colon and all the lymph nodes. The final pathology showed no residual cancer. Now she's 13 years out and doing fine.
Most people don't look forward to colonoscopies. I look forward to colonoscopies because I finally get to catch up with Dr. Cloud. I'm crazy about Dr. Cloud. I'm crazy about him. It's his personality. It's his comfort. He's a great guy.
For more information on any of the doctors you've seen on today's show, just go to our website, bestdocsnetwork.com.
Right now, it's time to head to our next doctor, neurologist Dr. Supriya Thirunarayanan.
I had double vision, and I kept going to an eye doctor for glasses changes. They would straighten it out a little bit, but it would always come back with double vision. It just kept getting worse and worse. So finally, on my last visit to him, after 4 different eyeglass changes, my eye started drooping. It was my left eye. It was finally closed. I went, I guess about a month and a half with it taped open so I could even see. And then finally my other eye started closing. So I was walking around with tape on both eyes so I could see.
Myasthenia gravis is an autoimmune disorder where your body starts producing antibodies and starts attacking your own nerves and the muscles. We have a neurotransmitter called acetylcholine which transmits the impulses from the nerve ending to the muscle ending. So in patients with myasthenia gravis, you start producing antibodies against the acetylcholine receptors in the muscle. So thereby the impulse is not transmitted to the muscle, so they can have weakness.
On my first visit to Dr. Thirunarayanan, she knew exactly what I had. I mean, she took one look at me and looked at the eyes and everything, and she knew what I had, and she told me right then the first day.
Gene is very special to me because he was my first patient with myasthenia gravis. And when he saw me initially, he actually could not just open his eyes. His one eye was completely shut down, and the other eye was almost 70% closed.
I guess it was about maybe 2 weeks after her treatment, I couldn't hold my head up. So she said immediately we need to start infusions. So they came to the house for 3 days straight and had me with infusions. That immediately popped open my eyes and made me feel a lot better.
I remember the first time when he came back to me, he was like so excited because his vision was back and his eyelids, he didn't have to tape his eyelids anymore.
After the infusions, I walked back in there, my eyes wide open and everything, and all the staff come up there and gathered around me. Dr. Tiru and her nurse was out there. They all stood up and clapped because I was able to see. I feel great. I mean, everything is looking up.
Many of us live with pain, but you don't have to. PAMA's here to help. Whether it's sports injuries, arthritis, or joint pain, the physicians of PAMA are dedicated to your wellness and getting you back to pain-free days. So what are you waiting for? Go to PAMAinc.net and find a physician or orthopedic specialist who can help you stop pain and live life to its fullest again. PAMA, pain freedom. Go to PAMAinc.net.
Hi, I'm Jim Knox along with Candace Kruger of the Best Docs Network, and if you're looking for the right doctor, we have the place for you.
That's right, it's bestdocsnetwork.com. It's all about some of the best doctors showcasing the latest procedures and helping change people's lives.
It's educational, informative, and real. Check it out, thebestdocsnetwork.com.
I was on a friend's boat and I missed my step and twisted my foot, and immediately I knew that something had happened. It hurt, but surely I didn't think I broke it. My friends were like, "You gotta go to the doctor, Diane, you gotta get that checked out." And I was like, no, it's fine, you know, I must have just sprained it or something. So I thought, you know, just with some time and staying off it, not being active, it'll heal itself. My job requires me to interview doctors as the producer for Best Docs Network, and I was at PAMA interviewing a doctor, and there happened to be one of their foot specialists there.
When I saw Diane's foot, it's like she had on a pair of nice red high heels, and one foot looked like it's supposed to, one foot looked like it was blowing up out of her shoe. And I said, "Is there something you need to tell me?" We sat her down, we examined all the necessary parts, took some x-rays, and sure enough she had a fairly substantial fracture of the 5th metatarsal. Had it been much more significant, it probably would have been a surgical thing. If she had let it go a lot longer, it would develop into what's called a non-union, or at least a delayed union, and that means that the bone is not healing in a timely fashion. And if it goes all the way to a non-union, that's a surgical problem.
Dr. Singleton was great. Immediately he said, "You need to be wearing a boot." The fracture was such that it could be healed by just staying off it and wearing the boot, the cast boot. Otherwise, possibility of having to have surgery, pins, and all that. And I've heard stories about that, and I just didn't want to go that route.
That's why it's so very, very important to be seen for your injuries in a timely fashion by a qualified foot and ankle specialist. If you want pain freedom, you got to be seen early. She should do fine now that she's wearing it in a very diligent fashion. She tells me she wears it all the time, and she's being a really good patient.
I work with PAMA physicians quite a bit and hear about how they're able to provide their patients pain freedom. So it was really great to be able to experience that.
They were trying to get my veins, if I'm dehydrated and if I was colder, that my veins just don't want to pop up. And so they would put the compresses on, put me under warm blankets, and sometimes it'd be, 30, 45 minutes to an hour, so I would be that much more anxious to see if that was going to work before, they were able to, actually get an IV.
When you're not able to get their vein or, stick them the first time, they don't quite understand why that's the case. There are certain things that do prevent us from being able to thread our catheter through their vein. Here at SDC, we have just received a product that is accessible to our PAMA physicians called the Vein Viewer. It's an amazing product.
Often the patient's number one anxiety coming into a surgical procedure is the starting of an IV. As an anesthesiologist, my role is to facilitate the perioperative process and make it as efficient as possible. And having a device like the Vein Viewer is helpful for patients who have veins that are difficult to find.
We can use it on all of the patients to be able to visualize a live view of a patient's vein.
And using this tool, it allows us to get the IV started potentially a lot faster than if we don't have it. And that ends up speeding up the whole perioperative process.
We are the first facility in the entire country to have this product. We're very, very happy that we have it. It makes my life as a nurse way easier being a pre-op nurse and starting IVs every day and drawing blood on patients.
As a PAMA physician, I have the confidence in knowing that we have the best equipment possible to start IVs even on the most difficult patients. It makes me feel more confident going into the operating room that we're going to have a good IV.
You know immediately, okay, this is the right one, or no, this is not the right one. And so it really prevents multiple sticks, especially for patients who truly do not have great veins.
I know that I can come in and be relaxed and not be anxious, and first stick they're going to get me. It's a great piece of equipment.
Raymond, a loving father of 3, had sleep apnea. At times, he stopped breathing at night until he met Dr. Troum. To find out more about Raymond's story and other life-changing stories, log on to bestdocsnetwork.com.
Being, almost 50 at the time, I was about 48, and I was miserable. I was absolutely miserable. It was like between the hot flashes and between not being able to sleep at night. I was like, I got to do something.
Women love hormone pellet therapy. It's a type of therapy where people can regain their youth. What we try to do is we try to assess the hormones of a patient at the age they are, and then try to supplement her hormones with hormones to give her the level of hormones that she had when she was younger.
Came in to see Dr. Troum, and with it he explained everything to me. It was very simple, quick procedure, not really much to it at all. I was kind of surprised because all of a sudden it was like, you're done, and I'm like, okay. And I said, well, how soon will I feel this, or when will it make a difference? And he says, well, it's like in 24 hours.
Well, we achieve those hormone levels with the use of pellets. They're small little tablets that we insert into the skin, usually in the lower part of the back. We insert it into the skin with a special procedure, just a small little poke hole, and insert the pellets inside in the fatty area. And for the next 3 months, what the patient has is small little pellets which act as little ovaries that slowly secrete the hormones that they need.
I sleep, I got up, I felt refreshed, and I was back functioning because I was miserable. I mean, I was having hot flashes all the time. I had that like burning that's inside, and all of it went away. It's the best thing out there. I mean, I can actually tell in my body when it's time to get a new pellet.
One of the other health benefits of hormone therapy done over the long run is that it increases the vision. The number one cause of blindness in women as they get older is a type of degeneration called macular degeneration. If you stay on hormone therapy, the chance of you developing that is less.
I've recommended it to a lot of my friends. You feel tons better. We love Dr. Troum. We all talk about him because he's so cute and he's so sweet. I love the office and all the people there.
Low back pain occurs in about 90% of the population over their lifetime. Of those 90% of people that have back pain, about 70 or 80% of them will have a second episode of back pain. Back pain accounts for the second most common reason for missing work or school behind the common cold. Back pain can be just a simple sprain, and it can be something as bad as a disc herniation or severe degenerative changes in the lumbar spine. The majority of the back issues are related to some type of degeneration of the back in some way. In this model here, I have an example of what I would say is the degenerative cascade. If you look at the very top disc space, which is right here, if you notice it's nice and plump and it's very high, this is a healthy disc. As the disc starts to go through a wear and tear process, you can kind of see that the disc space slightly collapses here, and you can see some changes which look like some kind of reddish changes in there. That's an inflammatory process that's occurring. Over time, if you notice, you keep coming down, you still see that the disc space gets smaller and smaller, but you start to see the formation of these little, what we would call bone spurs or osteophytes. These osteophytes are little edges of the bone that are reacting to the change in the disc space. If you look down here, you notice that the disc space is almost completely collapsed here, and the osteophytes on the side here are almost touching each other. These can be sites of bone pain. If you look here, you can see that there's nice space here for the nerve to come out, but if you look at this the one next to the bottom, you can see that it's pinched and there's not very much room for the nerve to come out. This can cause back pain and leg pain. Generally, when you have back pain, you don't need to go to the operating room. 90% of people that have back pain don't need a surgery. Generally, what you do if the pain is very severe or is long-lasting, you show up to a physician's office. What we do at that time is do a history and physical to try and determine what's the cause of your back pain. And we want you to get back to your life, your work, enjoying your family, your hobbies, and your friends. That's the goal of life, and that's where we want you to be when we're done.
Best Docs Network, DFW, is brought to you by Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
Well, that'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best physicians in the Dallas-Fort Worth area that have helped change people's lives. For more information for any of the fine doctors that you've seen on today's show, head to our website, bestdocsnetwork.com.
That's right, Candace. And for those who have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com. So long, everyone. We'll see you next week.